Hello, I'd just like to share about plasmapheresis for blood purification, which is a treatment that we offer to our clientele. What is it? It's basically regular blood purification to prevent and treat cardiovascular and cerebrovascular diseases. Why? Because as we age, we are unable to eliminate the increasing number of fatty plaques, cellular debris, or blood clots in our blood by our own existing mechanisms. And ultimately, over time, if you do not eliminate them, they accumulate in the blood and makes a person age faster and more prone to many illnesses. Now, what if I can tell you, you can wash out all the cellular debris, fats, clots, toxins in the blood, just like using a washing machine to clean your clothes. Because if you don't eliminate all these cellular debris, fatty plaques, ultimately, they will cause problems. You see, in your late teens or early 20s, the fatty plaque or the atherosclerotic plaque is already forming. And of course, in your 40s and 50s, if you do not take care of your circulatory system, it can lead to many problems. Exactly what is in this atherosclerotic plaque that lines your inner lining of your artery? Well, it's characterized by deposits of fatty substances, cholesterol, and cellular waste and fibrin, which ultimately gets oxidized and gets hardened and then stuck into the inner lining of your arterial wall, resulting in the buildup called this atherosclerotic plaque. So all the jiaoja, nasi lemak, bak kut teh that you eat accumulates over time in the inner lining of your artery, leading to eventually atherosclerotic sequelae such as heart attacks, strokes. And depending on where the problem, the buildup of the plaque is, like if it's in the coronary arteries in the heart, it will lead to angina, which is basically chest pain on exertion, or myocardial infarction, which is basically a heart attack. Or if the problems, the plaque forms in the carotid arteries in the neck, it will ultimately lead to occlusion of blood flow to the brain, resulting in stroke or transient ischemic attack, otherwise known as a mini stroke. And if it happens in the peripheral vessels, can lead to limb problems, intermittent claudication, limb gangrene, even resulting in amputation of the limb. Well, this is a machine. This is the machine that we use for plasmapheresis. The blood comes out one hand, comes back in the other hand, and your blood is cleaned 2 to 3 times, depending on the protocol that's used. Each person on average has about 5 liters of blood, so to wash it 3 times is a 15-liter flow. It is not the same as kidney dialysis, so don't mix the two. Renal dialysis that kidney patients go for 2 to 3 times a week. Dialysis does the work of your kidneys, removing waste products and excess fluid from the blood. It removes what the kidney cannot remove. And normal renal dialysis, and normally your kidney does not remove all these fats, clots, cellular debris that is accumulated in the inner lining of your artery. Oh, this is a testimony by a Hong Kong artist. I've forgotten how many years ago I had hearing problems in my left ear when I had the physical examination at the hospital in Hong Kong 10 years ago. I was told that my hearing left was only 10%. But today, after blood purification in Munich, I miraculously regained hearing in my left ear. It's still a bit unbelievable. So regular blood purification prevents and treats cardiovascular and cerebrovascular disease. So there you go. Machine set up. There you go. Imagine seeing all the rubbish that comes out. It's in a bag. Imagine that all in your blood, in your circulatory system, right? This is a person who drinks alcohol, or basically a drinker. went for plasmapheresis. As you can see, all the rubbish, all the oil that comes out. People who drink alcohol are prone to fatty liver, which can lead to liver cirrhosis and ultimately liver failure. This is a 69-year-old Ayi with high blood fats, hyperlipidemia. There you go, all the fats is concentrated into a bag after plasmapheresis. So thank you for listening.